Hello, and welcome to another CyberMD lecture. Today we'll be covering diastolic and continuous murmurs as they apply to the USMLE Step 1 exam. Diastolic and continuous murmurs are heart sounds that are heard during different parts of the cardiac cycle. Diastolic murmurs are heard during the diastolic phase of the cardiac cycle, which is the period of time when the ventricles are relaxing and filling with blood. Continuous murmurs, on the other hand, are heard throughout both the systolic and diastolic phases of the cardiac cycle. Aortic regurgitation is a condition in which the aortic valve, which is located between the left ventricle and the aorta, does not close properly, causing blood to flow back into the left ventricle during diastole. This leads to increased volume in the left ventricle, which causes the left ventricle to dilate, and eventually this can lead to left ventricular dysfunction. This can cause a diastolic murmur that is heard best at the second right intercostal space. The murmur is usually a high-pitched blowing sound that can be heard throughout diastole. It typically decrescendos after onset. Aortic regurgitation can be caused by a variety of factors, such as congenital heart defects, rheumatic fever, aortic valve infection, or an aortic root dilatation. Additionally, aortic regurgitation may be accompanied by a wide pulse pressure, which may result in head bobbing. Mitral stenosis is a condition in which the mitral valve, which is located between the left atrium and left ventricle, becomes narrowed, making it difficult for blood to flow into the left ventricle during diastole. This leads to increased pressure in the left atrium and eventually left atrial enlargement. This can cause a diastolic murmur that is heard best at the fifth left intercostal space near the apex of the heart. The murmur is usually a low-pitched, rumbling sound that can be heard throughout diastole following an opening snap sound, which is the sound of the mitral valve finally popping open to allow blood to flow from the left atrium into the left ventricle. Mitral stenosis can be caused by a variety of factors such as rheumatic fever or a calcified mitral valve. The opening snap sound may generally be used as an indicator of disease severity. If the left atrial pressure is higher, the opening snap will occur sooner, and this indicates worse disease severity than a later opening snap. If not treated, left atrial dilation, atrial fibrillation, right heart failure, and pulmonary congestion may all be sequelae of this disease process. Patent ductus arteriosus, or PDA, is a congenital heart defect in which a blood vessel called the ductus arteriosus, which connects the aorta and pulmonary artery in the fetus, does not close properly after birth. This allows blood to flow from the pulmonary artery to the aorta in utero, but then from the aorta to the pulmonary artery if left open for too long after birth. The flow from the aorta to the pulmonary arteries leads to increased blood flow to the lungs and pulmonary hypertension. This defect can cause a continuous murmur that is heard best along the left sternal border, particularly at the infraclavicular area. The murmur is usually a blowing, high-pitched sound that can be heard throughout the cardiac cycle. It is loudest at the S2 sound. PDAs are often associated with congenital rubella infections or prematurity. In summary, diastolic murmurs are heart sounds heard during the diastolic phase of the cardiac cycle, while continuous murmurs are heard throughout both the systolic and diastolic phases. Conditions such as aortic regurgitation, mitral stenosis, and patent ductus arteriosus can cause these murmurs. Each of these conditions can have different characteristics and locations of the murmur and can be caused by different factors. I did want to make note that while rheumatic fever can affect any heart valve, it most commonly affects the mitral valve, and this is what will most likely be tested on the USMLE Step 1 exam. These murmurs may also be accompanied by other signs that can aid in the diagnosis. Proper diagnosis of these conditions requires a thorough history and physical exam, as well as additional testing such as an EKG or an echocardiogram. It's important to note that these conditions can also have long-term complications if not treated properly, so early diagnosis and treatment are crucial. Additionally, patients with congenital heart defects may require close follow-up and management by a cardiologist. Thanks for tuning in to this lecture, and be sure to subscribe to our content.